Mission Health. Be well, get well, stay well.
New conversation for you that folks may have not seen you talk about. So today we're talking about your role in community investment, something that you and I work together in. Would you like to tell folks a little bit about that and what that means for Mission Health?
Thanks so much, Ashley. It's great to be here today, and there's so much to talk about and how we invest in the community and work together with various community agencies across Western North Carolina in making an impact in the continuum of care. It's more about what's happening throughout someone's stay in the hospital, when they go home, and how we can promote a healthy environment. So this is really a portion of work that I love to do, and again, it's about partnerships and how we can move together. And this is so important with the Affordable Care Act in regards to access to care. So it's really great to be here, and we're honored to be sharing this conversation today with Jackie and Pisgah Legal Services as we move forward.
And Jackie, I know Pisgah Legal Services is known for the legal aid that you provide to people in our community. So this may be a little bit different too, talking about access to care. Tell us about your role and what Pisgah Legal does in the realm of access to care and insurance.
Absolutely. So it is great to be here and partnering with Mission Health on making sure that people know about access to care. And you're right, when it comes to Pisgah Legal Services, we're known as a community nonprofit organization doing civil legal advocacy. Our services are free, and we help people meet their needs when it comes to basic needs. And one of our core priorities is around access to quality, meaningful, affordable healthcare coverage and healthcare services. So that really fits in to our mission and to being able to, as a part of the ACA open enrollment work, help people to enroll in coverage, understand how to use their coverage, link to providers and different services, and really help those who don't have access to coverage enroll in coverage and be able to use it.
I think I'd just like to reiterate and why it's so important as we work together. In Western North Carolina, approximately 14% of the population does not have access or insured. And to us, that's really important. And so as we open the doors so that people find that they can eliminate the barriers is so important. And again, the partnerships across the region is just so vital as we go to the community to make this available. And Pisgah definitely leads the way with that.
Thank you.
So let's dig into that a little bit more. What kind of things specifically is Pisgah Legal doing to make sure that people get the help they need to get covered?
Well, first, we are in the middle of open enrollment. In fact, we're about 2 weeks from the deadline. So I think one of the things I really want to emphasize is that open enrollment ends on Saturday, December the 15th. That is the last day to get enrolled. So for people that need coverage, we are out there spreading the word, working with partners to make sure that everybody who needs coverage or has questions about what coverage means, they understand that this window of time is only around for another 2 weeks in order to get covered under the Affordable Care Act. We are also providing in-person assistance to help families and individuals enroll. We have trained, certified health enrollment experts who are really there to help families look at their options, to understand what meets their budget, what meets their medical needs, and kind of look at all the different combinations of that. We're also, as Sonia mentioned, we are a part of a regional partnership of different community organizations who are out there spreading the word and helping people enroll. Partners like Mountain Projects, the Council on Aging of Buncombe County, Legal Aid of North Carolina, and others who are collectively across the region doing this work to help make sure that we get as many people covered as possible by that deadline.
The thing I would add with that is that it's all walks of life. So if you think this really doesn't apply to me, it can't hurt to have the conversation to see where opportunities are, because again, this is opening the doors for access. And so small employers, people that are just getting started in a new job, there's just so many different opportunities, and to me it's a great benefit for our country as well as Western North Carolina.
Yeah, I'm really glad that you mentioned that, Sonia, because it is. And when people know Pisgah Legal for the civil legal aid work that we do, our services are free, and we are focused on helping low-income families in that aspect of our work. But when it comes to the Affordable Care Act, we are a resource to the entire community. There are no income limitations for being able to access our services, and we are working with folks from all sort of different backgrounds. We have such a rich artist community, a lot of self-employed individuals, early retirees who are waiting, looking to bridge coverage between retirement and Medicare age. These are a lot of the different individuals who could really benefit from this coverage and wanting to make sure that they know about it.
And Jackie, I'm glad you brought up the Affordable Care Act because I think there's a lot of confusion about that. And I think I've heard you say the Affordable Care Act is still law. Can you tell us about that?
Sure. So the ACA it is still the law. Really trying to make sure people are aware of that. It's important to say that because it's been in the news for years. Confusion, discussion about repealing, replacing. Will it be the law next year? Should I get covered now? What will happen? And I absolutely want to emphasize for people that it is the law. It has not changed. Good quality coverage is available for you right now. Open enrollment ends on December 15th, and we're talking about coverage that is available to you through the entire calendar year of 2019. So it's really important to act now to get that coverage in place so that you have it for all of 2019.
Those are great points. And one of the things I saw in my Facebook feed last year when it was open enrollment time was some discussion about financial assistance. What's the status of that this year? Has anything changed?
It has not changed. Financial assistance is still available. And I keep saying the Affordable Care Act, the Affordable Care Act. Well, that affordable piece is such an important part of it. What makes it affordable for many people is actually that there is financial assistance available. Subsidies that can help you cover the cost of those monthly premiums. And we see at Pisgah Legal Services people and families walking away with great plans at great prices. $0 a month premiums, $5 or $10 a month premium for really great coverage, low deductibles, low copays. So the financial assistance has not changed at all. We encourage people to make sure that they are going in and updating their income information every year to make sure that they're getting the best deal possible.
Ashley and I had the opportunity to be in the event of the kickoff at Pisgah Legal, and it was just amazing to me some of the stories that were shared that I had not thought about before. And I think that might be something worthwhile as we talk about different people in walks of life, because it was so impactful in how this has made a difference to people in Western North Carolina. So could you share maybe a story with us, Jackie?
Sure. Well, and so let's go back to sort of the unexpected, what it means to really have coverage and what coverage, that difference that coverage can make for you and your family as you think about, we don't know what will happen tomorrow. So we helped several years ago an individual who is healthy, is younger, hadn't had coverage, small business owner, owns his own farm. His name is Christopher. And he came in, decided to look at plans and prices, see what was available to him. It turned out that he was able to get a great deal. We enrolled him right before the deadline for open enrollment was over. And about 2 days into the coverage year, he found himself needing an emergency surgery because his appendix ruptured. Wow. He was able to go into the hospital, get the surgery, get the coverage and the care that he needed, and to really focus on recovering and taking care of himself. And he has said he was not worried about his family or what that impact would have on his farm and his business, because he knew that this was covered. And that is, really one of the things as you're thinking about, well, I am healthy or I'm not really expecting to need anything, but we never do know. And having that peace of mind is an important part of coverage.
And that's the way it should work. It really is.
Yeah.
It's great.
I love hearing that story, but one of the things that brought up is, I think you said 2 days after he was covered, he had this incident where he needed coverage. So if I enroll now, when does coverage begin?
So coverage will begin on January 1st, 2019. So you've got to enroll by December the 15th. That's your last day to enroll in coverage through open enrollment. And we're talking about a plan that would start with the calendar year.
Great. Well, I know another thing that folks are worried about are pre-existing conditions, and that's been a topic of discussion in the news. What can you tell us about that?
So pre-existing conditions are important to so many people. They're important to me and to so many people who are probably watching. The protections for pre-existing conditions under the Affordable Care Act are by far one of the most popular aspects of the law. Because before the Affordable Care Act became law, having a pre-existing condition was often a huge barrier to being able to afford coverage or to be able to access coverage for that condition. And the Affordable Care Act protects that. So you cannot be denied coverage based on pre-existing conditions, and you cannot be charged more because you have a pre-existing condition. And that, as I mentioned before, the ACA is still the law. Pre-existing condition coverage and protections are still in place for policies that are sold through the Affordable Care Act marketplace.
Isn't it great that we have these resources available in Western North Carolina to interpret all of this and help us navigate through it? So thank you so much, Jackie. I just always feel so much pride when I hear you talk about this, because you definitely are an expert in this work.
Thank you. Appreciate
So
that.
one of the other words, though, that you mentioned that I want to pick up on is really, shopping around. So pre-existing conditions, that's one thing that we know now about how that's covered through these programs. But what are some other things that folks should be looking at if they're looking at shopping around for health insurance?
Well, so I really encourage people to shop around for a couple of reasons. Number one is if you're not sure, as we talked about the affordability aspect, if you're thinking, well, is financial assistance available? Would I qualify for it? Come on in, meet with someone at Pisgah Legal or one of the other community resources. Look at what is available to you and what financial assistance may be available. We see many more people qualify for really good financial assistance, and likely, and a lot of times more than what they thought they would qualify for. The other aspect is that there are some new regulations in place this year where less comprehensive health plans are being offered. Now, this is outside of the ACA marketplace. So these plans being sold outside of the ACA marketplace are not required to cover those same critical protections for pre-existing conditions as I mentioned before. They're not required to cover things like medications or maternity services or mental health coverage. So it's really important that if you are looking at plans outside of the ACA marketplace, that you shop around and look at your options inside the ACA marketplace too, to know what you're getting, to make sure that you're asking the questions and understanding the coverage that's available. And again, as a resource here in the community, our services are free, confidential, and I want to emphasize, we're not there to pressure anyone or any family to enroll in a plan or to pick a particular plan. We want to serve as that resource and that be there to offer the information and to walk through all of this information so that they can make a decision that best meets the needs of their family.
And that's so important, to have an objective resource versus someone feeling like someone's pushing a product one way or the other with them.
So Jackie, tell us, how are some of the ways that people might be in touch with Pisgah Legal? Do you walk in, phone number?
So I believe on the bottom of the screen there is a direct phone number to Pisgah Legal Services that viewers can call us directly, or there's a link to go online to our website where you can book appointments. And again, it's not just Pisgah Legal's appointments that will show up there. You can put in your zip code and a list of appointments based on location will come up, because we are really working with our community partners. We know we've got to be available early evenings, weekends, out in the community at libraries and community centers where people live. So we're trying to be as convenient as possible to be able to meet the needs of everyone who needs an appointment. I will say that we have some walk-in availability for the next 2 Saturdays in Asheville at our office at 62 Charlotte Street. And then finally, in partnership with Mission Health, we will be having a last chance enrollment event on Saturday, December 15th at Mission Health's AB Tech Event Center. And that will be from 9 a.m. to 4 p.m. People can walk in. I will say the earlier you can get there, the better, because we expect to be busy. We know that this deadline is going to draw out a lot of folks, but we want you to come down. We'll have people on hand to help you enroll and to answer your questions so you can get covered by the deadline.
So Jackie, every year it seems like the time frame gets more and more condensed, and this year it's just been amazing how quickly our community and our region has rallied to meet the shortened timeline, is there anything else that you would recommend to anyone as time is passing quickly? Today's the 30th of November. That we can do, or to help get the word out in regards to making that access more easy to remove all barriers?
I would say, spread the word through your networks, your connections. Really, if you're listening and watching and are thinking, well, I'm covered, think about friends, neighbors, coworkers, community members who would really benefit from knowing about this. We know that this year and last year, the enrollment period has been shortened tremendously, and marketing and outreach material, the budget from that on a federal level has been cut significantly. So the more that we can do locally with our great partnerships and those who have the ability to spread the word, it's really important for it to go out far and wide.
Absolutely.
And Jackie, I appreciate everything you've told us about what Pisgah Legal is doing, but Mission Health, we're serving 18 counties in Western North Carolina. I know you mentioned at the opening how there are other agencies across the region working to support enrollment efforts. Can we access those through those phone numbers or that website?
Absolutely. So those different partner organizations, if someone calls us and they're not in one of our 6 kind of core counties that we're serving, we will work with our online scheduling system that has all of our regional partner appointments in there, and we will be glad to help that caller and book them an appointment, whether it's with Pisgah or any of the other community partners. And the same is true when you go onto our link on our website for an appointment. It will have not just Pisgah Legal appointments, but all of the appointments that are available in that area.
I think it's just important to reiterate, 14% of the population in Western North Carolina is uninsured, and what all these organizations are doing is trying to come close to home to make it easy to access, and again, provide an open door for access to care. So thank you for that.
Well, thank you.
You guys have done such a great job covering key points, but we have had one question come in from the comments that I wanted to share with you all. So Samantha's asking, if I have a job but can't get health insurance through that job, can Pisgah Legal Service or one of the other enrollment organizations help me to get coverage?
Absolutely. This is a great time to come in to look at options. So if you are employed and there's not an offer of coverage through that employer, the Affordable Care Act insurance is really a great option. So yes, please, we would be glad to meet with her or schedule that appointment and talk through options.
That's great. Thank you. Okay, so if there are other questions, please feel free to add them in the comments and we'll answer them. So Sonia, tell us more about what this partnership with Pisgah Legal looks like and other ways that we work together.
So we do so many different things throughout the year, and I want to reiterate that what we've tried to do is to help partner as limited resources have been available to Pisgah to help supply laptops so that they can expedite the process. So when people come in, they don't have to wait as long and they have the ability to streamline it. Also, trying to get printed material out has been really important, as well as provide a space at the Mission AB Tech Event Center was really important for us. This is key in how we work as a community. We've partnered with Pisgah so much in regards to efforts from the standpoint of folks in need that are in our hospital that are concerned about things from, how do they address, issues at home, how a landlord is interacting with them. They educate us a lot in regards to providing resources in our emergency department to help patients, especially those that are high risk, how they can get plugged back into the community so that they are, again, aligned with the right caregivers for the work that's done. And it's an ongoing dialogue in the things that we do. So it's just tremendous from that standpoint. And again, we try to emulate this relationship with Pisgah Legal with the other agencies across Western North Carolina. It's about how we come together as community to address the needs and make access and support as much as we can. And that's where I think Mission really tries to reach out beyond our walls, recognizing healthcare and a healthy population is more than just a hospital. And so I think that for us, the partnerships and the alignment in our goals is so important. As we hear what the community needs, we work with the agencies that can help address those different issues. It's just, again, phenomenal. And Western North Carolina is just so innovative and resilient that it's just really a pleasure to be part of that process and partnership.
Absolutely. Absolutely.
It's great to be a part of all of this and in this conversation, and I do want to say thank you so much, because the partnership that we have with Mission Health really does help us at Pisgah Legal Services to meet the needs of the community. In the past 2 years, you've stepped up when funding and outreach efforts have been really limited, and really helped us to get the word out, and it's been incredible, so thank you.
Thank you.
Great. Well, anything else you want to make sure that our viewers know?
Well, I definitely want to, again, really emphasize that the deadline is coming up. So December 15th, that's your last day to enroll. Lots of different organizations across the region are here to help you. So Pisgah, as well as other organizations, free services, one-on-one appointments, sitting down, looking at all your options. And again, it's confidential. We will not be trying to pressure you into any decision, but really just want to serve as that resource to making sure you have all the information you need to make a good decision about a plan that meets your needs and your budget.
Great. Well, thank you both for joining us here today. I know that our team who's supporting us behind the scenes is going to make sure that these phone numbers and these links are available to folks who are watching, and we just appreciate your time and all that you do for our community.
Thanks so much.
Yeah, thanks,
Thank
Ashley.
you.